Ever think about all the stuff that goes on behind the scenes at like hospitals and clinics?
Yeah.
I mean, we see the doctors, the nurses, the fancy equipment, but there's this whole other world that most of us never even think about.
Right, all the systems and processes that keep things running smoothly. Kind of like the engine room of a ship, huh?
Exactly. And today, we're diving deep into one of those crucial but often overlooked aspects of healthcare, health information management, or HIM.
HIM. Yeah, that's the backbone of a well-functioning healthcare system. Seriously, without accurate and accessible health information, things can fall apart pretty quickly.
We actually have this really interesting document called What is Health Information Management? And it's full of real-world examples from Nigeria that honestly made me realize how much HIM impacts our lives every single day.
It's true. Like, think about it. Every time you visit a doctor, they're recording information about your health, your medical history, medications, allergies, everything. All that data needs to be managed properly. That's where HIM professionals come in.
So what exactly is HIM?
Well, simply put, it's the systematic process of collecting, organizing, storing, analyzing, and protecting patients' medical information.
Okay, so it's not just about filing paperwork.
No, it's way more than that. It's about ensuring that this vital information is accurate, accessible when needed, and always kept confidential.
And that confidentiality part is super important, right? Like, we're talking about sensitive personal data here.
Absolutely. HIM professionals are bound by strict ethical and legal guidelines to protect patient privacy. In Nigeria, we have the National Health Act of 2014, which specifically addresses data protection and confidentiality in healthcare.
So they're like the guardians of our medical information.
Yeah, pretty much. But beyond just safeguarding data, HIM plays a critical role in improving patient care. Let me give you an example. Imagine someone is rushed to the emergency room in the middle of the night. They're unconscious, can't communicate. What happens then?
That's scary. I mean, how can doctors treat them effectively without knowing anything about their medical history?
That's where a well-managed health information system becomes a lifesaver. Instant access to a patient's medical records, their allergies, current medications, past surgeries, all that can guide critical decisions and potentially save lives.
Wow, that's a powerful example. And this document also talks about how HIM is vital for public health initiatives, like tracking disease outbreaks.
Right. Nigeria has faced challenges with infectious diseases like Lassa fever and cholera. HIM professionals play a key role in analyzing data from various sources to identify trends, hotspots, and potential risk factors.
And that helps in like controlling the spread of these diseases.
Exactly. By analyzing patient data, healthcare authorities can quickly identify outbreaks, allocate resources effectively, and implement targeted prevention measures. Remember the COVID-19 pandemic?
Oh yeah, how can we forget those daily case updates?
Oh, those were only possible because HIM professionals across the country were diligently collecting and compiling data from testing centers nationwide, providing real-time insights that guided the government's response strategies.
It's like having a bird's eye view of the nation's health, isn't it? So it's about more than just responding to emergencies. This document also highlights the role of HIM in research and policy development.
Absolutely. For instance, there was a study in northern Nigeria on diabetes prevalence. Researchers analyzed hospital records and discovered that diabetes was much more widespread than initially thought. This discovery prompted public awareness campaigns and increased screening programs.
So because of HIM, they were able to identify a problem and take steps to address it. And the document mentions another interesting example, something about maternal health, right?
Yeah, sadly, data analysis revealed a concerning rise in maternal mortality rates in the northern part of the country. This information prompted the government to launch targeted maternal health campaigns, increase funding for rural clinics, and improve access to prenatal care.
It's amazing how data can reveal so much and lead to real action. It's clear that HIM is crucial for public health. But what about the impact on like the everyday experience of patients in hospitals?
Well, remember those mountains of paper files in hospitals? The endless searching and waiting.
Oh, yeah. Not a pleasant experience.
Exactly. Transitioning to electronic health records, or EHRs, has been transformative. Hospitals like the Obafemi Awolowo University Teaching Hospitals complex have seen massive improvements in efficiencies since implementing EHRs.
So, faster access to records, less waiting, and smoother workflows.
Precisely. And with all this sensitive data being digitized, data security is paramount, right?
Right, that's a big concern. How do they make sure patient information is protected?
HIM professionals ensure strict adherence to data protection protocols as mandated by the National Health Act. They implement safeguards like access controls, encryption, and regular audits to prevent unauthorized access and breaches.
So it's a multifaceted role, isn't it?
Right.
Protecting patient privacy, ensuring data integrity, supporting research, and streamlining healthcare operations.
Absolutely. It's about improving efficiency, accuracy, and ultimately the quality of care patients receive.
It's incredible how much we rely on these unsung heroes working behind the scenes. So next time you're at the hospital, remember that there's an entire team dedicated to managing your health information and ensuring you receive the best possible care.
And maybe this deep dive has sparked some thoughts. How can we as a society support further advancements in HIM? Wider adoption of EHR systems, investing in training for HIM professionals, advocating for strong data privacy policies. These are all steps towards a more robust healthcare system, both in Nigeria and globally. It's something to think about, right?
Absolutely. Food for thought.